Thank you. Thank you very much. My case is a patient, 25 years old, followed up by a colleague for recurrent posterior uveitis. Because he has low visual acuity in his left eye, he consulted in France, and the specialist here say that for the right eye he has peripheral vasculitis. He began with the high doses of steroid. Then he returned Morocco with 7.5 milligram of steroid with Emerald, and in the left eye, this is secondary maculopathy. We can't do anything. 6 months later, I see him for visual acuity decrease of his right eye, right eye 710, and the same acuity in the left eye with the vitreostendal and the peripheral vasculitis. This is his fundus, and we see he has a peripheral vasculitis, and this is his OCT. We see that he has vitreostendal. We see the vitreostendal and macular edema. In collaboration with the internist, we decide, because it's a recurrence of uveitis under immunosuppressant, it is indication for biotherapy. So we make a pre-treatment investigation, and we found that quantiferon was positive. We continued the previous treatment, and we give him a preventatory antibacillary therapy. After 15 days of treatment, he called me, "Hello, doctor, I am starting to see well, even with my left eye." After 3 weeks of treatment, I see him. He has 10-10 in the right eye and 7-10 in the left eye. We give him this time a curative antibacillary treatment, and we make investigation to look for any other localization of tuberculosis, but it was negative, and under this treatment, excellent evolution, and no more recidivis. And this is his first OCT, right eye and left eye, and under treatments, normalization of his OCT. Last access, I see him last month. No recidivism, no functional things, good visual acuity, and no things of uveitis, normal OCT. Tuberculosis uveitis is rare, probably underestimated. It's infectious and immunologic involvement. Diagnosis is difficult because there is no specific functional things, and we can find not other things. Busch's nodules is uncommon, and we must, in our countries, we must think about it when we are faced on vasculitis with a negative etiologic assessment. Sometimes it's easy to make the diagnosis like this miliary secondary to biotherapy. Thank you.
Yes. Thank you, Dr. Hasnaa, for this presentation. I think TB is coming back in our region. I mean, we have a lot of shisha smokers over there, and this is a cause of transmission in our country most of the time. It's that's why it's spreading, and sometimes in its extrapulmonary TB, sometimes we check the chest, we do CT, there is nothing in there.
Yes.
We have females over there sometimes with a TB. I found a couple of females with a TB. And it's very unusual sometimes to find it extrapulmonary, but it is there. So Dr. Ahmed was asking me, do you do, I will ask you the same question, do you do routine investigation for TB in your differential diagnosis at the beginning?
Because I don't see the patient in the beginning. It was with another. Actually, every patient has uveitis. I make quantiferon.
Any uveitis, multifocal inflammatory lesion, whatever you do in the differential TB.
When it is posterior uveitis, and I see also uveitis with the nodular uveitis in the anterior segment in the one patient who has tuberculosis miliary.
Yeah, thank you, Dr. Hasna. I saw that when she's presenting her
I think
cases,
there
there
is
was.
another thing that's why tuberculosis is always in our country, because the patient, when he feel bad, when he feel well, after 1 month or 2 months of treatment, he stopped his treatment.
Relapse, you mean? They get
Yeah.
a rapid relapse.
Usually, it's one of the things that when you have bacterial uveitis with vitritis, so it's one of the essential tests to do is tuberculosis. Nowadays, we have the quantiferon gold test and others. Because tuberculin skin test not always available everywhere now.
And it's not always reliable sometimes
Reliable.
if you don't do it the right way.
Yeah, so there is collective collaborative study about tuberculosis all over international called codes, groups that making differential and criteria for diagnosis of anterior tuberculosis, uveitis, intermediate, posterior, treatment, we need to treat, what are the things that you put it in our mind. But agree with you, nowadays with using this campaigns for smoking,
Yes.
for all this is, give, I mean, not all, our bodies is sometimes cannot just only exhibit the pulmonary tuberculosis, but sometimes that myobacterium getting to our, blood and getting there in a latent stage. So this is where, we have the possibility of autoimmune or infectious in the choroid. Thank you, doctor. It was great. Yeah.
It's also difficult to interpret the result of quantiferon, because in our country all the vaccination is obligatory, so it's difficult to say it's tuberculosis or it's not tuberculosis.
Are not diagnosis tuberculosis, ocular tuberculosis, just only in the test, but we have something else with. If it is plus, yeah. So that's latent tuberculosis, positive quantiferons with neuraminidase uveitis, either anterior, intermediate, or posterior vascular.